Communications Committee. Thank you, Holly. And as of last Thursday, I'm also on the board. So thank you, everyone. I'm going to popcorn to Dana.
Hi, everybody. My name's Dana. I'm on the Medicare for All Connecticut Advisory Board, and I joined because I didn't have healthcare for most of the pandemic, and before that was on and off Medicaid, and not having health insurance because I was a freelance worker, and it was really difficult. And I work in mental health, and I see how hard it is for folks who are experiencing mental health challenges to navigate the healthcare system. It just makes it impossible for folks to get physical and mental health care, especially when they're suffering or in crisis. So that's why I joined up, and it's been great to work with you all for the past year, and I look forward to working on other resolutions in other cities. And I'll popcorn it to Amelia.
Hi, everyone. Amelia Lowry, she, her, hers. Based off of Dana's answer, we're saying why we joined. So I personally joined because, healthcare should be a human right. I think that there are a lot of things, especially like comorbidities or just reasons why people are dying, and it's unnecessary, right? These things are so preventable. We shouldn't be suffering as a community, as a whole. I've seen my own friends say that, hey, I don't need this, and then get into a lot of financial troubles. And I just think that it shouldn't be that way. It shouldn't just be for wealthy people to be able to get healthcare. It should be for everyone. Is there anyone left to go that I can popcorn to? I joined
Pretty
late.
much
Sorry.
only myself, Amanda, Rep Michelle, and Dana went, and yourself. So everyone else is free.
So I'll popcorn to Peter.
Hi, my name's Pete. I'm in Hamden as well. I'm on the communications and electoral committees as well as the board. I've been involved for quite a while, and really not much more to say that hasn't been said already. But I've only got so much time and energy to devote to worthwhile causes, and it seems like this one is the one that cuts through to the most other things. It's about racial justice and labor security and gender equity, and just so many different things get touched on with healthcare. And so ensuring truly universal healthcare would bolster so many other causes, and just it seems like a no-brainer to me. So that's why I'm here. And I guess I can go over to Kerry. I don't think we've heard from you yet.
No, I'm not muted. Hi, I'm Kerry Swift. I've been joining these meetings probably off and on for months. I live in Brookfield, Connecticut, which is kind of a red town. So but we're right next to Danbury, which we're kind of is in between. And we're a small town, but Danbury is a city. This became an important cause for me back. I worked in health insurance at a health insurance company. I was actually ended up as being supervisor of premium billing way back in the late 80s. And I just realized what an evil business it was. I mean, we spent a lot of time, and this was when AIDS was a huge issue. There was no cure, people were dying. And of course, if you have full-blown AIDS, you really can't work. We insured New York City. So it was very difficult, and just you realized, and I said at that time, I'm like, we're going to have to move to universal healthcare. There's no way that this is a sustainable model of business. And then I left that to manage a doctor's office. So you're on the other side of it and realize how evil it is. And then I left, I had children. And as my children grew up, I began to work back again in my college job as a fitness instructor. So I've been a fitness instructor, personal trainer for years. And I will tell you that if my husband didn't have insurance, I would not have insurance. I was working before pandemic 4 jobs. Now I'm working at like 6 places. Everything's part-time. There's no benefits. You don't get a day off. You don't get, there's nothing. And this is a lot of people. My children, my kids are 29, 27, and 21. And my 27-year-old, he's still is, I believe, on the ACA. We got him on the Affordable Care Act. He couldn't get insurance, even though he was working a lot. They keep you somehow underneath. My daughter finally got a job with benefits, but it's really evil. And I was also, should say, I've been involved when my kids were in school. We found out that they were basically being poisoned. They were doing a lot of construction while the kids were in school. A lot of illegal things. So I kind of became involved in environmental causes then and better health in schools. And it was making our children sick. It's just shocking that public officials have no concern for health. Everything's about how much this is going to cost you. So anyways, that's my background. And that's why now that due to the pandemic, I'm not working as much, even though I'm at more gyms. I just think it's time to get back involved in my other causes now that my last one is a senior in college and my jobs. I almost finished paying for that. So I cannot believe that this country, it just gets worse and worse and worse, the healthcare, and we have to go the other way. And it's never going to happen with the industry pressures unless regular people really push. So that's my long-winded introduction.
And who would you like to pick next, Kerry?
Sorry, I forgot I had to do that. Who has not gone? Has Clara gone? Clara.
No, I have not gone. Hi, everyone. I am Clara Stanowski. Pronouns are they, them. This is actually my first meeting with Medicare for All Connecticut. I moved to Connecticut over the summer for a job. I'm an organizer with AFT Connecticut, and as things have kind of slowed down a little bit, I've been trying to get more involved in certain groups, and I feel really strongly about the need for universal health care. And it's great to be here with all you guys, and I echo all the sentiments that everyone has already previously shared. So it's great to meet you all virtually.
Thank you, Clara. Welcome to Connecticut.
Yeah, thank you. And I don't think that, who hasn't gone yet? Has everyone gone?
Dorothy has not gone yet.
Dorothy then.
Oh, okay. Hi, everyone. My name is Dorothy Johnson. I've been fighting for single payer since the 80s. I was a union member in the United Electrical Radio and Machine Workers of America. And from that time up until now, we should have had a better healthcare system. But since we don't, I am still willing and able to get into the fight to make a change in our healthcare system. And I agree with what someone said before about the mental health care. Even though I do have Medicare and I do have a secondary insurance, if you need to see a mental health specialist, you can only go so many times and then it's on you to pay. And the average person doesn't have that type of money to pay. So I'm going to keep on fighting, and I hope everybody else will keep on fighting too until we get a decent healthcare system in the United States. And one other thing, we pay for the politicians in Washington healthcare. Why can't we have what they have? And that's about where I'm going to end, but thank you.
Thank you so much, Dorothy. I see Sivan is the last person that has not gone, but I didn't think Sivan was supposed to be here tonight.
Oh, hey. Hi, everyone. I'm calling in from Florida. Can you hear me?
Oh, God.
Yes, we can.
Yeah. Sorry, I'm at dinner. I'm in Florida with my family for dinner for my sister's 30th birthday. Hi, I'm Sivan, she, her, hers. New Haven, originally from New York. I'm on the board. I believe in Medicare for all, because our healthcare should not be tied, health should not be tied to your wealth. If I did not have healthcare through my small business employer, who suffered greatly during COVID, small businesses are suffering even before COVID, I would not have healthcare. So essentially echoing what everybody else has said, there's absolutely no reason that we are the only country in the world that does not provide healthcare for our residents, our citizens, everybody in this land, other than the enormous corporate lobbying that happens. And the only reason that we don't have it is just that, as the previous person mentioned, they have it in DC. Why don't we have it? It's because they get paid directly by the lobbyists. So we have done so much amazing work, and I'm so proud of everybody, all of my friends here. I'm glad to call everybody here my friends. We've done such amazing work here this year with Medicare for All. I'm so happy to see everybody here, the new people as well, because we've got a shit ton of work to do in 2022, and we need all hands on deck. And let's get this done. Thanks, guys.
Now that's dedication. Wow. Okay. We lost Rep Hughes. I know she does a lot of double meetings, so that's okay. She'll be back if she can be. She's very dedicated. She's definitely one of our big champions in the legislature for sure. We're so grateful that we have some really, really, really great champions on our side. David Michelle, Ann Hughes, Mike Winkler, Robin Porter, Marilyn Moore. Those are just a few behind the scenes who have done, great work for us and with us, alongside of us, leading the charge. Now, hopefully, guys, this is like my only second time hosting a meeting, so just be gentle with me when I try to share my screen. Hopefully I'll do okay. If not, Amanda will rescue me. Before I start going into our presentation, Rep Michelle, did you want to give any kind of an update or, say anything before we get started?
No, I think it's good. I'll jump in the conversation later.
Okay.
Yeah.
All right. I just wanted to give you the option. Okay.
Don't give too much to the legislators. We get, how they prioritize at the Capitol. It should be the reverse here.
I know, but you guys have really, I look, I've said this before in other meetings. I now have a view from the other side. Although KTP does have great champions as well, it is certainly not in other organizations as good as you guys are to us. I definitely can say that hands down. So we appreciate the communication that you guys give us for sure.
Thank you.
Okay. Thank you. So let's see if I can do this. Are you guys seeing this okay? Okay.
Yes, it's
Amanda.
good.
Oh, thank you very much. Thank you. All right. Well, let's see if we can do this here. All right. So there we are with our beautiful logo from Amanda. That's also part of our 2021 history, is that we have amazing, amazing graphics from the awesome Amanda Weiss.
I just wanted to ask, you could click the 3 dots at the top and you might be able to make it full screen.
Oh, it's not full screen for you guys?
No, it's actually, I think, connected to your browser.
Oh. Sorry, guys.
It's okay. I think this should be fine. You can just keep scrolling. I wouldn't.
Amanda, why don't you share your screen and Holly can say next slide? That might be better. So Holly, why don't you stop sharing?
Okay.
Yeah.
Sorry, guys. My apologies.
Hey, that's okay. No problem.
I tried.
Yeah,
It really wasn't bad. You did fine.
Yeah.
Thank
Yeah.
you.
You always do
Technology
great.
is tough. It's always changing.
Can you guys see my slide?
Not fully. I guess it was just like mine. Oh, there we go. It's almost the whole screen. Great.
Is this better?
Yeah, perfect.
Okay.
So we have the best communications team around. They get stuff done. Between Amanda and Pete and Renato, they are the triumvirate, I call them, of the communications team. So they do everything on our social medias and everything like that. So here's our beautiful logo that we came up with in 2021. So tonight's meeting is going to be all about looking back to all of our accomplishments in 2021, which were fantastic. We had so many that I just want to go through. And go ahead, Amanda, next slide. Okay, so for those of you who are new, and again, welcome, Clara. I think that was your name, my apologies. So what is Medicare for All Connecticut? We are a community of volunteer organizers and activists who believe that healthcare is a human right. And I know that a lot of you had said basically the same things. We want to make Medicare for All a reality here in Connecticut and throughout the United States. We are fighting for guaranteed healthcare for all on the federal and state level. And as you know, we are also endorsing municipal resolutions for federal and state single payer systems. Next slide, please. Okay, this is our board of directors and our advisory panel. Each person is involved in our processes and in our decisions, and we make a lot of our decisions as a group. And each person was chosen because of their specialty and what they bring to the table and their backgrounds and, you know, just a lot of what each person has and can bring to us in different points of view and different parts of the state. And we wanted to make sure every single community was represented as best as possible and not leaving any marginalized community out. The only voice we don't have yet is someone from the trans community. So if anyone knows of a good advocate in the trans community, if they would be so kind as to, you know, refer them to us, that would be fantastic, because we would really love to have that voice heard on our board as well and or on our advisory panel, because we really don't want to leave anyone's voice unheard. Next slide, please, Amanda. Okay. So we do a lot of collaboration with a lot of different organizations. You know, I said in the beginning that I wear many hats. Every single solitary person that's on our board wears many hats and is involved in many organizations because of their principles and what they believe in and their want to help others. And that's who else we connect with and who believe in the same things that we do, such as Central Connecticut DSA, CARE, which is the Community Alliance for Research and Engagement, Connecticut Drivers United, Connecticut Working Families Party, Connecticut NARAL, Pro-Choice, Green Party of Connecticut, New Haven People Center, New Haven Rising, Physicians for a National Health Plan Connecticut, or PNHP Connecticut, Public Citizens National Medicare for All campaign, Our Revolution Connecticut, Quiet Corner DSA, Sunrise Movement New Haven, Students for National Health Plan, or it's called SNAP Connecticut, Unidad Latina en Acción, I think I said that properly, Western Connecticut DSA, Yale Endowment Justice Coalition, and Yale DSA as well. We've worked with many partners. We're networking as best as we can in order to get more voices heard and to get stronger and stronger to make sure that those who are in power hear us, and to make sure that our goal is met, which is to pass single payer universal health care. Next slide, please. Okay, so what have we accomplished in 2021? Well, Wyndham passed their resolution in January. Also in January, I believe HB 5340 went through the Human Services Committee as well. March, we incorporated as Medicare for All Connecticut, or M for ACT. We held our very first organizational meeting in May, and we held a phone bank in support of HB 5340, an act to establish a statewide single payer healthcare program, which hadn't been done since Sustanet in the 80s, I believe it was. We contacted every House representative, and 1,750 signatures and emails were sent through our action network. We are very busy. Then in May, also, SB 1090, Husky for All study bill passes the Human Services Committee. That was a huge feat. That's a big victory for us. Next slide, please. Medicare for All Connecticut began canvassing, phone banking, and tabling to promote a Medicare for All resolution, New Haven. That was terrific, I have to tell you. I personally had never gone door to door, and I had never personally done tabling. And it was really, really great to be able to go out into the community and explain to people what Medicare for All really meant, because the majority of people in New Haven had no idea what it meant. And once you educate people of what it would mean for them, everybody is on board, and it really got a lot of excitement going in the community to think that they would actually have access to healthcare and they'd be able to afford it, which was huge. So for me personally, getting involved in such a grassroots movement like that was terrific. I loved the education aspect. It was awesome. So as I showed you in the very beginning, in July, we launched our new logo and our new designs, thanks to Amanda and collaboration of the people on the board and some input from a few other people as well, which blew our minds. In August, over 500 letters were collected and sent to the New Haven Board of Alders. And the New Haven Board of Alders approved the Medicare for All resolution. And I know that I was at the meeting. One of our other advisory panel members was at the meeting, and Dorothy Johnson, who is also on this call tonight, was at the Alders meeting for the actual vote. And I can't recall anyone else, but I could be missing. A lot of our partners were there as well. And it was really awesome to hear it voted upon and to hear it was unanimous. To hear that unanimous vote for a Medicare for All resolution in the city that Yale is in was incredible. That's a big deal, guys. Okay. Also in August, we launched our Medicare for All Connecticut website, which is www.medicare4allct.org. Next slide, please. In September, we continued canvassing and phone banking to promote a Medicare for All resolution in Hamden. From October to November, we endorsed Hamden and Cromwell electoral candidates Anya Goldsby, Justin Farmer, Abdul Asmanu, Lauren Garrett, and Ted Stevens. And for those of us who even had a question if our grassroots efforts made a difference, Ted Stevens winning by 11 votes in Hamden really told us that what we were doing made a difference. And then Stanford passes their Medicare for All resolution, which we supported a lot of the behind the scenes with documents and testimonies. We didn't have to do phone banking and things like that, but we did do a lot of supportive roles, and David Michel was definitely a large part of that as well. Okay, go ahead. So we cannot say enough to thank everyone who was involved in getting a lot of our goals met this year and surpassed, as far as passing these resolutions and you know, getting ourselves established as a nonprofit, and just the things that we've been able to accomplish because of the support of some of our partners, such as New Haven Rising, Connecticut Insulin for All, Our Revolution Connecticut, which was also one of their members was at the New Haven Board of Alders, SNAP, PNHP Connecticut, CARE, especially the REACH Steering Committee, which is Racial and Ethnic Approaches to Community Health, Public Citizen, their Medicare for All Resolutions Committee, Central Connecticut DSA, Working Families Party, and Hamden DTC. Next slide, please. Okay, so what are we as an organization looking forward to or towards in 2022? So we have to just complete the very long application process for our 501c4, which means that we can endorse candidates, which is something that we decided as a board that we absolutely wanted to do in order to, as you saw, help people get elected that believe in Medicare for All. So that was very important to us as a board. But also, in order to get funding, you need to be a 501c3. So we will be applying for 501c3 status in the future in order to be able to go after grants and apply for grants. And we are also looking forward to the short session in February at the Connecticut General Assembly so that we can hopefully get the single payer study bill put through again. And we have a very strong committee of co-chairs that I think will be able to pass it through. I don't want to talk about that right now, but I have a really good feeling about this particular committee. And midterm elections in 2022, as a electoral committee, there has been a lot of work done on the process for endorsements, and so we're really looking forward to those as well. Okay, so we've been talking a lot about resolutions, and we have a lot of towns that are active in different stages. So Fairfield is in the very early stages, but they are starting their processes. Groton, we've talked to some council members and they're trying to get together to get that process rolling. So it's in the early stages. Hamden, it's in the late stages, but it's also in the early stages for the new regime coming in. Excuse me, that just came in. Middletown is also in the early stages. New Haven, Stamford, Willimantic, New London have all passed, which is incredible. Okay. So where else can we organize on the local, state, and national level? That's a question for all of us. So we would like to know, what is your New Year's Medicare for All resolution? What would you guys like to see happen with Medicare for All in 2022? We will share some of our resolutions with you guys, but to have you think about it, there are some easy ways to get involved in the coming year. You can sign up for our mailing list, learn more about Medicare through Medicare for All through books, websites, panels, excuse me. You can have conversations with your family, friends, your neighbors. You can sign up with us for phone banking, which actually is pretty fun. I enjoy it, to be honest. You can also do canvassing, which is also, you get out there, you meet people. It's a lot of fun. You can join us on Action Network, sign and share petitions. You can offer up printing services, or if you know someone who's in the printing business that would give us a really good deal or something like that. Translation services, if you speak or are fluent in another language, that would be very helpful. If you know of anyone who owns an event space, or you know of a nonprofit space that likes to rent out to help out nonprofits, that would be great. Of course, we would always accept and need for printing materials and things like that, donations. You can join one of our many committees that we have set up. Okay, next slide, please. So you can follow us to stay on top of all of our news and events. And you can see the website information here, our Twitter, our email address, and our donate page. That's Instagram, Facebook, and Twitter. Sorry. I don't know all the little informational things.
Oh, you were right, Holly. You did it. I was gonna say, I'm very envious of these photos. They were taken when it was much warmer out and people were tabling, and
yeah,
I feel warmer just looking at them. So
some of those days were quite warm, but it was an experience. It was really, I know that there were the core 3 that were out there every single day, or maybe the core 4. You know, I found it very exciting. But okay, so Amanda, would you like to start and share with us perhaps maybe what your experiences have been, or maybe what you would like to do for 2022?
yeah, I'd be happy to. So I joined in June, and so it's just been an amazing journey. I joined a committee quite early on, and it was really nerve-wracking. And I actually started by signing up to Canvas, and then I just kind of fell into a committee. And while I was a little nervous at first, I ended up really enjoying it. So that's my my persuasion to get others to join a committee, because we are always, we're a team, and it's never just one person. So if you're ever too nervous because you don't think you may have the time, or you don't know what you may be able to put into it, it's always what you're able to do. And so, but as far as, for my 2022 resolution, my Medicare for All resolution, definitely becoming more educated. I feel like there's quite a few more books I should read up on. I'd really like to continue canvassing in Hamden and beyond. And as well as, I think I am currently trying to figure out if there are other committees that I'd like to join. But also just little things like starting more conversations with friends and family, especially. I'm sure some people will be doing this over the holidays, but just kind of trying to talk to people about what it means for everyone, and maybe try to get them to look at it from a different perspective, and just sharing that knowledge. So, and trying to get more people involved. So I'm gonna popcorn, if that's okay. I'm gonna popcorn to Rana.
Thank you. I am the secretary of this group, but my goals and resolutions, I guess, are twofold for 2022. One is, Holly mentioned in the presentation that we are soon going to turn into an application in for 501c4 status. The goal is February 1st. We have it mostly done except for a couple of like long narrative and budgetary, I don't know, projections, I guess you'd call them, so that when the campaign season of 2022 begins for the state legislators and also federal legislators, we will be in a position where we can support the ones who support Medicare for All Connecticut and reach out to all of them with information. So that's my number one resolution. And my number two resolution is very specific towards resolutions, actually. I'm in New London, and Groton was mentioned on the list of towns that would be great possibilities for resolutions. We already know several people who live there who want to work on a resolution. So my other resolution is to work with people in Groton and other Southeast Connecticut towns to get town resolutions, both to increase the pressure on legislators to support it, not just people, but the towns within your jurisdiction, sharing with you how they're struggling with paying health insurance for their city employees, for example. So to increase that lobbying, I think it's a really important thing to do as much as possible. And I will popcorn to Pete.
Good timing, because I actually have to hop off in here in a minute. But yeah, my main resolution is finally getting the Hamden Resolution over the finish line. Been working on it on and off, mostly on for the last several months, but for probably going on 2 years now. So it'll be nice now that we've got a mayor who's behind it and legislative council that's behind it, to finally just give that the nudge over the edge that it needs. And I'm hopefully work with some of our partners in the General Assembly, like Michelle, about getting a study bill for a state level Husky for All, which is something I'm really curious about learning more about. So yeah, learning about that, moving forward with that as well. And if I can popcorn, since I already mentioned him, let's go to Rep. Dave Michelle.
Thank you, Pete. Looking forward to work with you. That's definitely one of the priorities this year. I think is not only working on as much as we can at getting, again, it's going to be a short session. So it's again, we're going into dark waters where we're not sure, like, I mean, last year was a long session. It was treated like a short session. So let's see what this year is going to look like. But definitely pushing on language. We got to keep the effort going through, even if it's a short session, doesn't matter. I remember when I was first elected in the first couple of months, I remember hearing that a good bill takes 5 years to pass at least. And maybe my colleague Michael Winkler can talk about that. But definitely working the legislative system and getting language through, getting a public hearing, going as far as we can go, getting a study. But at the same time, work on the language, continue working on the language on the main bill, because the study really is only a small part of the big effort. And then also potentially maybe looking into helping to fundraise, maybe to get that study if we're not able to push it through hard enough through the legislature. That would be fantastic. Again, I remember all the buildings around the Capitol have insurance names written big on top. So, there's definitely a tough lobbying over there. And in the conditions that we're working with, when people don't really see each other face to face, then it's easier for lobbyists to control bills with the leadership and governor's team where they agree, right? So yeah, these would be three things: legislature pushing the study bill, and then continuously working on the language for the main bill, and then also looking at the alternative where we maybe potentially fundraising to get that study. But we'd have to also make sure the legislature would recognize it. So we have to talk about that, all those things. And I'll popcorn it over to Amelia.
All right, so my main goals would be to increase my education and research. I really want to feel comfortable and confident in the terminology and language. And I think this would help me build confidence to go canvas more, right? And I think this also will help build my community relationships because people see me, they're like, oh, I know who that person is. And I think, community for me is at the foundation of progress and growth. And I think there's just nothing more powerful than a community that comes together and saying, hey, like, we do understand this. We're not, I think there's certain words that on my vocabulary radar, it doesn't like immediately trigger something in my head to understand what it means. And I just want to make sure that this is a conversation that is comfortable for everyone to have because it's important for everyone to have. And I'll popcorn it over to Holly.
Thank you, Amelia. So one of my very first before 2022 resolutions is to be able to finally get the research and education together to start the very first meeting, I hope soon. Speaking of getting more comfortable, Amelia. So thank you for calling on me because I was thinking, oh my God, I got to get that meeting straight. So hopefully we'll get that before the beginning of the new year. But my New Year's my Medicare for All resolution is to try to remember to wear my Medicare for All hat in all of my jobs, because sometimes I forget to bring my partners with me to this realm, which is terrible, and I should never do that. And I'm going to try to be better with that and bring the rest of my partnerships with me here, and vice versa, because all of my work, my advocacy work goes together. And I'm really going to work hard on that next year for sure. And to grow Medicare for All Connecticut, and to kind of piggyback off what David Michel said, was to be able to fundraise to do our own study bill, not worry about it as a bill. That's one of the reasons to try to establish a 501c3 is to be able to go after grants, to be able to get that kind of money that we would need to do a study. So that was our double-edged sword thing. And so that's my resolution, is to try to get grant money into Medicare for All Connecticut and as a backup in case we cannot get the bill. But I really have a good feeling I'm going to try for it. So that's mine, and I'm going to popcorn over to Dana.
Hi. I think that my Medicare for All New Year's resolution would be close to what Rep. Michelle and some others have said about trying to get something passed in the state legislature, or as Holly said, getting enough funding so that we can do a study of our own. And I think it would also be great to continue to connect with other people doing this work in other states and learn from each other. I know that Sivan recently joined a national network, so hopefully the information that she brings from that connection can help us learn about others' efforts, how we can do things in a different way, but continuing to build this from the ground up, getting more and more cities to pass resolutions, I think will be really great as well. So yeah, that's mine. And I'll popcorn to Kerry.
I think my resolution would be to become more involved. I'm kind of, I think, in, being in the western part of the state, in Upper Fairfield County, we're also in a very Republican area. So I think, but, the thing is, there's another Kerry in town with me who wants to work on Medicare for All as well. So that, the thing is, we got a lot of things accomplished when I was working in the schools and statewide, and that people said we never could. So it just has, it's persistence, it's working. I have been going to Zoom meetings too with a national group as well for Medicare for All. And it is really heartening to see how many towns and people, what they can accomplish. And I'm glad to see Stanford pass because I'm originally from Stanford, actually. My mother still lives there. But anyways, so my thing would be getting more involved. I mean, I still am doing my fitness thing too, and it's hard to, and I'm on a town energy committee, but I just, like I said, I decided this year, since a lot of my work went bye-bye, it was a sign that it was time to start getting involved in causes that were important. And this, as I said, since the 80s, I've realized the need for universal health care. It's just absolutely horrible in this country that we, the first thing, and I'm actually, I had cancer too. And well, I grew up in Stanford and our neighborhood was poisoned by the city dump. So yeah. So you realize that it can happen to anyone. It can happen anywhere, even communities that are well off. We were in North Stanford and you think you are, well, it can happen everywhere. We are being poisoned by our environment and then we're being made to pay for the damage in medical bills and health outcomes. And it's just, we have to start making changes. So, and I just would like to be more involved in that. Oh, I have to send it over to, who didn't go? How about Charles?
Before Chuck goes, I just want to recognize that State Rep Mike Winkler just joined us as well. And that's Chuck Panaccio from One Payer States. I just wanted to thank him for coming as well. And so I just wanted to make sure that we recognized everyone. So go ahead. I'm sorry. Go ahead, Chuck.
Yeah. Hey, thanks so much. And Kerry, your story is touching, and this is, so many of us are suffering, and it's good that we've got this solidarity, this love for each other coming together. I'm just jumping over here just to say hello. I'm between calls. I love folks in Connecticut. I think many of you know, I lived in Norwalk when I was a little boy. So I have a fondness for New England and Connecticut especially. We're doing when you're all done after your call tonight, if you're interested, we're doing a call on direct contracting entities, the latest assault on Medicare. It's an effort to privatize and destroy Medicare. Direct contracting entities we're hosting. It's really a last moment kind of an effort that we're putting together with Susan Rogers over at PNHP and other folks. So I do not want to disrupt what you all are doing. You're doing amazing work. I'm very close with Stefan and Rana. Both are on the board of One Payer States. And I just want to celebrate you. Just want to wish you all happy holidays. And thank you for all the great work that you're doing. You're an inspiration for us all across the country. Just keep firing away. Thank you so much.
Oh, thank you so much, Chuck. Thank you for being here. And if you want to put the link in the chat, please feel free to do so. And for those of us who are still able to keep going after this meeting, we would not mind joining you if we're still good afterward. Please do feel free to put it in the chat.
Okay. Yep, thanks.
Please. No,
Okay.
please. Thank you.
Sure.
So we have Clara left. And I believe the person ending in 040 has not introduced themselves, unless that's Ann Hughes, but I'm not sure. So Clara, please go ahead and tell us what your Medicare for All 2022 resolutions would be.
Yeah, so my resolution's probably pretty simple. It's getting more involved with this group and helping out with a lot of things that everyone else has mentioned. So pretty short and pretty simple, but yeah.
Thank you.
Short and simple works. Are there any ways that you're specifically excited about, or anything that you think would be of interest?
Anyway, because I live in Hamden, so helping with getting the resolution here passed, I would definitely love to help out with that.
Yeah, we'd be happy to have more people on board, especially with Hamden, although Pete would be definitely the guy to talk to about this. But I think we're going to try to start the conversation soon with Lauren to see what we need to do to get the resolution passed. So fingers crossed. But yeah, if there's
awesome. Sounds
anything
good.
specific or anything, there's always the link about what you might want to get more involved with. In that it says join a committee button, but it's not actually just for committees. It's for like whatever you're thinking of getting or would be interested in. So
Okay,
yeah.
perfect. Yeah, I'll definitely check that out. Thank you.
Yeah, no pressure. We're just happy you're here. So thanks for coming.
Yeah, happy to be here.
State Rep Winkler, do you have a Medicare for All 2022 resolution, and or would you like to say something?
One second. I've joined you at least 3 times tonight because I seem to be having some sort of connection problem.
I saw that. Thank you.
I will certainly do all I can to help get the study bill through. I do think that we could get it through in less than 5 years because without meaning to be offensive, the study bill really doesn't cost any money. If you want money for something, then it's probably a minimum of 3 years. But if you just want to study something, I think it can be done in 2. So I'll do what I can to help David Michelle and Ms. Hughes get the study bill through. And to be honest, the way I do my representative work takes just about my life. So I'm afraid that beyond that, I couldn't do much more.
That is all we ask of you. Thank you so very much. And for both of you, I don't think Ann Hughes is on the call unless that's her number. Oh, it is. Okay,
Yeah,
cool.
it's me. Sorry, I was driving and I didn't know how to unmute myself because it's a weird thing. But yeah,
it's star
hey,
6.
Yep, I figured that out.
But also
yeah, no, I wanted to echo everything Mike said and Dave Michelle said, and it's really about collaborating with Medicare for All Connecticut to really get the public to understand the opportunity that we have for incredible savings and incredible, healthcare that's possible. And a lot of other countries have figured it out, but we could do this as a state, but we have formidable special interests that are trying to keep really the mass from the public. I think, that this just makes so much sense, and we could do this, but this is inevitable at some level, but Connecticut could be a leader in these next couple of years, especially if we get the study out and done. So I'm excited.
By the way, and Medicare for All and like everybody, we worked last year also on expanding Husky also to those eligible that are undocumented, regardless of their immigration status. And because I know that's not in the list, Holly, but you guys did a lot of work on that as well.
Yeah.
And we supported that effort.
No, we did 100%, and we gave testimony. Thank you. We did not put that in there. We did. We supported it. A lot of us testified, and we've done a lot of partnerships with a lot of Husky Students for a Dream. I have participated in the Husky for All. I can't remember the name of the work group, but I've participated with that with CCAG a few times. So there's a lot of work going on still, and I have met with CCAG on 3 different occasions with 3 different people. So there is still work happening, and I actually came up with a really good committee, guys, that I think, well, let's see, 2 out of the 3 of you are on, and one of our champions is the co-chair of. So I think it would be a pretty good place, and it really does go together. So
yeah, I would echo that this coalition building, we're all pulling in the same direction and getting more and more, people and groups to you know,
Yeah.
share that vision. So yeah, we should put tangentially that we increased Husky for all mothers, regardless of immigration status, up to 12 months postpartum of delivery. All
Yep.
babies, regardless of immigration status, and children up to age 8, which is
Yeah, that was downplayed by our own party.
Yep, and it should be up to age 18, and I'm ready to gung ho push for up to age 18 at least, regardless of immigration status. All children in Connecticut, come on.
Didn't we start at 21 and then went down to 18, then went down?
Yeah, and then 12, and then 8, and we pushed back the start date to 2023 for no good reason.
Right. So, well, so I think you guys know which committee I'm talking about. I don't want to really put it out there just yet because I haven't talked to the chairs of the committee yet, but my friend is on that committee, you know, my arch nemesis, State Rep Aurora. So I think it would be extra sweet to have it go through where he is too. I just think it would be a good place to go. And I think we have a good shot. So
yeah, Rep Aurora's view on a single payer is that it killed millions of
people. I know. So yeah. Oh yeah. But whatever. He is inconsequential, so I was told. In this particular committee, he's inconsequential. So we'll see. But I have a little more digging to do, and we'll.
If I may
we'll
ask, what district is he from? What area? Do we know?
Westport.
He's Greenwich. He's all Greenwich. Baby.
There it is. There it is. Yeah. Yeah.
You have no idea. But anyway, let's not go there because I'm in a pretty decent mood. So I think we're gonna, I really have very good feelings about this because we have really accomplished so much. Just think about it. We've really only just become incorporated as a real quote unquote organization in what? Less than a year, and we have already accomplished so much. We should be so proud of ourselves. And I am very proud of us as an organization, and we're just going to keep getting better and better and larger and creating more power and building more networks. And we're going to do this thing. We're going to get this study bill passed. I know we are. We're going to do it. Even though it's a short session, we're going to do it.
Yeah, the study bill that should be an easy piece. I mean, when I referred to the 5 years, I was more thinking of the actual bill itself, which, you know, it would be great if we could pass it, but that's for sure not going to be happening this year because it wouldn't really make the way through the system. Just so that everybody understands, in the Connecticut legislature, we have on election, following our election, it's 3-year mandates. Following our election is long session, and our second year is called short session. Long session, everybody introduces bills, and short session, Mike Winkler and chairs and committees introduce bills, and I will also introduce bills. But when you introduce bill as a legislator, you're pretty much just, I think, mostly making more of a statement, because it's really the chair's bills that are going to go. So if you want a bill to pass during short session, you have to go to the committee chairs and convince them to put this bill out as a committee bill. It's only committee bills on short session.
Right.
It's unfair. It's kind of really weird. And it basically means it's leadership bills, 1 year out of 2. So when you're elected and you have a mandate of 2 years, half of your time is really, you know, your efforts are really, really, well, it depends where you stand. But with me, typically, they are not necessarily lined up for leadership. So there we go. Yeah.
So have we taken care of everything on the agenda, Amanda?
I would
would say so. I think that this was more informal, as we discussed. We just wanted a good conversation about what people were hoping for to see in 2022, what some of their goals were, what their resolutions could be, which if anybody wants to, we created some small graphic if you'd like to kind of write down your resolution and then share it around and see if there's friends and family that also want to share their resolutions. So.
Unfortunately, my family is completely opposite minded than myself, except for 3 family members out of my entire family. But I did switch one person's mind, so that's good. I'm working on it one at a time.
That's something. Yeah. I mean,
one at a time.
It's just, it's, you know, just about having a conversation, see where they're coming from. And, you know, I think it's possible. So you can take one.
We might be at the point to just announce, you know, what we're doing in January for the meeting, because it will be back to a little bit more formal. And then, I don't know, end one early. It's holiday season.
Yeah, I was gonna say 8:10, pretty decent time. Don't want to keep everyone here too late.
Yeah.
Holly, do you have details about the specifics of the January general meeting?
I have some. I can tell you that our friend from Connecticut Insulin for All, Kristen Whitney Daniels, will be coming to present in our January meeting, but she will not be presenting regarding specifically insulin. She is a member of the Prescription Drug Affordability Board, and they're doing some amazing work. And we definitely need to be alongside of them and helping them to push through their legislation that they're working on as well. Any incremental change that makes things, and especially prescriptions, that are life-saving and life-sustaining, more affordable, is something we need to be a part of as well. So she has all of the details, and she will certainly share all of that with us in January. And as it gets closer, please look out on our social media for a more detailed description of what she will be talking about, because it is not completely set yet. She said once they finish their December meeting, she will certainly let me know exactly what she will be presenting in January. So that's about it for the January meeting, and we will be definitely more formal. You know, hopefully we'll still have a lot of back and forth to keep everyone engaged with us, but mostly Kristen will be telling us about the Prescription Drug Affordability Board, which is really important. Okay. And please keep track of us on all of our social media accounts. They are doing such an amazing job of keeping everyone updated. That's Amanda and Pete and Renato. So if you have any questions or anything, please feel free to reach out to us at info@medicareforallct.org. And we'll get back to you as soon as we can. And if anyone has anything before we sign off for the night, please jump in. Unmute yourselves. Okay. Thank you, Amanda, for putting everything in there. So if not, I hope everyone has an amazing, happy, safe, healthy is the most important holiday. And we will see you all in January. Enjoy.
Thank you everyone for coming. Really appreciate it.
Right. See you then. Have a good holiday.
Have a great holiday, everyone.
Happy holidays.